This was a blank slate. This is not just a hospital out in the middle of nowhere that decided they wanted to start teaching anesthesia residents and bring in physicians. This was Brown.
There was this idea that, hey, we can actually create something that's really special, a whole new department that is evolving and creating new things for our specialty.
Our goal is never just to create a residency program. Our goal is to create a world-class residency program.
Anesthesia is a big, big field, and there's a variety of cases, and there's a lot we need to know about every surgical field. Whether that's cardiac surgery, whether it's acute pain, you get to work with people who are very passionate about the field and very excited to teach you about what they specialize in. And that's something that's contagious.
You work very closely with the residents and the trainees, so most days it's just the attending and the resident. They're observing you with your interactions, and we're observing them and giving feedback all throughout the day on a one-to-one basis. So I think that is quite unique.
The patient is the ultimate focus for everything we do. Our trainees should live here and know that they can take care of any patient in any condition as they present in the future. And it's also the focus for our research mission. Every clinical program we have here is trying to make it better for the patients.
To be part of the Brown medical community, you need to be participating in cutting-edge research. Research shapes the way we're going to be practicing going forward. That's the drive I expect from my colleagues, from myself, and certainly the sentiment I expect from our residents.
The opportunities for education here for these residents is amazing. Right? There's a huge amount of diverse surgical types, there's a huge amount of patients who need care here, and each resident gets an unusually large experience in these things.
The resources available to you, the type of cases that you have here, creates a training environment that really doesn't exist anywhere else in the country. And compound that with the fact that we have no fellows, which means when you're a resident and you come to Brown, you have access to everything. If there's going to be a neonate taken care of in the state of Rhode Island, it's coming to you. If there's going to be a patient put on bypass to have some sort of cardiothoracic operation, it's coming to you. This is a monopoly. It's the only game in town. And that's really special when it comes to a training program.
Being in a culture of excellence, we're certainly pushed to grow academically and clinically. I think we are certainly residents who will come out with a lot of energy and a lot of preparation to be impactful in our fields, whatever they may be.